Meeting's off to a great start. In particular, the goal for us is to be able to convince everyone here that it's time for us to take action on our own part. We don't have to wait for large approval from committees or institutions, and we certainly don't need policy approval or new laws or new regulations. Chuck Denham, I think, got across the message very clearly. It's time for us to connect heart and head and connect those to hands and start.
So to have Dennis Quaid and Dr. Denham and then Dr. Wood tell us all about that, to me so far it's a great start to what I think will be a lot of good sessions and a little more tactical. How does it work? So yeah, I'm inspired.
So our project looked at getting everyone in our division bronze certified, so all 80 of our physicians in general internal medicine and all 150 allied health. So we started in September. We had a 3-month time frame where we wanted to have everyone with the language of quality improvement and with the information available for bronze certification. We embarked on doing that. So we thought this way, because we have a lot of projects that we do we have 2 of the resident firms in our clinic and they're working on process improvement activities, that we all have the same language and understanding of what's going on. So that's what we did. We're able to achieve it. We were the first division in the whole enterprise to have everyone bronze certified, so 252 people did it.
I think in the next 2 days I'll be able to take many more things than I would have just attended just reading books or something, because it makes you meet the leaders of quality right away, makes you understand where quality is going in the thing. And we heard the lead speaker talk about how it's important that we are a business, and as in any business, adversity and adverse effect, how we deal with it is our own business, how we deal with it. And also to be fair on the customer, which is, we shouldn't call them customer or patients, they think we are already doing it. So we own it to ourselves to really do it. And if we are not, ethically, morally, we may not be doing the right thing.
Really, as a bedside nurse, the biggest thing that jumped out at me is viewing it from the patient's perspective. Taking a look, if I was the patient or if it was my family member lying in the bed, what would I want?
It's been a wonderful experience. It's definitely made me think outside the box and how we need to go in the future, and I feel that people are understanding that it is, a lot of what we do at the bedside and how we can make a huge impact. And a lot of times I feel as if that, it's orders that come down upon us, but I think this is really neat that it's a whole nother way of thinking. To saying that we need to bring our heads and our hearts and then bring it out through our hands. I find that is just a great quote that I definitely will take with us, because I feel that way a lot, is that I try to take my emotions and what I've learned and give it to my patients every day.
I came hoping to learn. I'm a young leader, so I'm hoping to just be a sponge and take in as much as I possibly can and use it towards better patient care.
Exactly. I'm going to take some of the knowledge from what other people are practicing and try to see if I could fit those things into my practice as well. Kind of bring it.
As a healthcare professional, I really can identify with what was said this morning, how we need to have leadership and technology and our practices to be looked at and considered more closely, and how important it is for leaders to embrace value in healthcare and safe patient care. So it was very motivating, and it was it puts the passion, it creates the passion to be ignited, and that's what we need as healthcare workers. He talked about how patient stories can really help us identify what we need to do as leaders and to spread that fire to others, and I think that's really important.
It's a very important gathering, and the main reason is Mayo Clinic has a leadership role, and we have a strong quality culture at Mayo Clinic, and if we are able to share that with other healthcare institutions around the country, or even more around the globe, we will improve not only the quality of care, but also will improve patient outcomes, and that's our ultimate goal. So I think it's a very important gathering for that reason.
I didn't
Make the first sessions this morning, Hoyt, but been here at the storyboard sessions here this afternoon, and just a great turnout of storyboards. As you may know, I've been to every quality conference since I started, and this is probably the biggest session we've ever had for storyboards. Quite a variety from all over, and a lot of different topic areas, and a lot of interest here as well. I hope they can see a lot of the nice things we're doing here at Mayo to work with patients to make things safer for our patients and improve the quality of care as well. I think if you just come by here, I think you can pick up at least a half dozen ideas that everybody can take back to their respective work units and work to help their own patients as well. A lot of good ideas, a lot of good sharing.